I do want to actually volley a question back at you in the KRAS space, if that's okay, one that caught my eye. In your opinion, does KRAS in someone that has no smoking history, would they be sensitive to immunotherapy in this setting?
It's very interesting. We rarely see KRAS in someone with a no smoking history. It's less than 1% of the patient population. For example, if you see a KRAS G12D mutation or E mutation, those patients who are never smokers are not generally responsive to immunotherapy. They have lower mutational burden and lower neoantigen load. So their tumor, actually, the way I explain it to patients, is looks very similar to normal tissues in the body. As opposed to someone who's smoked for many years, that tumor may look very different from the normal tissues in the body, and revving up the immune system would actually be more helpful. So a patient who never smoked, who developed a KRAS mutation, I would more focus on targeted therapies. And there are novel targeted therapies that we talked about for G12C. What I didn't talk about today is that there are also therapies in the clinic now, investigational, development on trials for G12D, as well as these pan-RAS inhibitors that are really exciting. So, definitely reach out to your oncologist and ask them about what trials are available in this space. But I would shy away from immunotherapy. Curious, Dr. Preeshagul, your thoughts on never smoker, KRAS mutation. What would you do?
I mean, I echo exactly what you said. I think it's very rare to find a KRAS alteration in somebody that has never smoked. And I think my first gut would be, let's make sure this is a lung cancer and this is not a metastasis from your gut. And this is not a different primary. Because KRAS alterations are seen in colon cancers. They're seen in stomach cancers, pancreatic cancers, a lot of GI malignancies and other malignancies. So that's, anytime someone has something that just kind of smells fishy, I always make sure you up to date on endoscopy, colonoscopy, pap smear, mammogram, all the age appropriate cancer screenings. Other than that, I think targeted therapies are really exciting in this space. We are, sotorasib, and adagrasib came about, and we talked about drugging the undruggable, and now this orphan child has more of a home. And while these drugs are not approved in the frontline setting, I would look for clinical trials. That's where the answer is, I think. So I would talk about trials, and I would make sure that there isn't a secondary malignancy.
Yeah, I couldn't agree more.